Hello, everyone. My name is Jean Kolak, and I'm part of your hospital's community relations team. I'd like to welcome everyone here with us this Tuesday afternoon to our community education webinar, Understanding Your Patient Portals. We know this is a hot topic that holds a lot of interest for you and all of our patients, and we're hoping to help make that process of both registering for and using the portals as clear and as straightforward as we possibly can. And we have the three caregivers with us today who are the experts you want to hear from when it comes to our York Hospital patient portals. We have Maria Evangelo. She's a healthcare information management specialist who's been with York Hospital for over 22 years, all in support of patient record management and security. And we also have Kami Wiles, an electronic medical records analyst with over 20 years experience involved in the EMR process. And lastly, but certainly not least, is Fia Yarian, who is an EMR analyst, coder, and auditor. And she's held various positions here at the hospital over her 24-year tenure, most recently EMR related, but also including practice manager at Great Works Family Practice. So some of you may know her from that position. And now that you've been introduced to our Crackerjack portal team, I'd like to quickly review some of the housekeeping notes that we have so everyone will know what to expect with us today. The presenters will speak for about 40 minutes, and then we'll host a question and answer session for everyone. So firstly, you'll learn about our hospital patient portal through both a short video and a presentation by Maria. And following Maria, Fia and Kami will provide the very same for York Hospital's provider practice patient portal. The remainder of the time will be earmarked for any and all questions that you have regarding either of these two patient portals. But first, you'll need to know how to get your questions to our presenters. As participants in today's webinar, rather than a typical Zoom meeting that you may be used to, your audio has automatically been muted. So this means you'll only see today's presenters along with their slides, and you won't see any other attendees either. You'll not be able to ask questions in person because of that. So if you'd like to ask a question, please just click on the Q&A icon that you'll see at the bottom of your screen. It's a little left of center next to the word poll, I believe. And don't use the chat or raise hand icons, as we're not going to be monitoring those. So although we'll hold on answering your questions until both of the presentations have ended, you can certainly feel free to type in your questions as we move along today, and we'll simply answer the questions in the order that they've been presented to us in the Q&A below. And finally, a quick reminder that today's webinar is being recorded and will be available on York Hospital's YouTube channel within just a few days. But so you don't have to check and see when it's there. We'll send you an email containing the link to the video and also answers to any questions that may have come in following today's webinar, or any that we might not have time to answer today, which could, if time becomes an issue, we don't anticipate that will happen, but you never know. This same email is going to have some links for you to various flyers that support the information that you're learning about today, and they'll include step-by-step instructions. Those flyers will also be accessible on the portal page of the website at yorkhospital.com. And if you'd like to submit a question after today, if you forgot to ask something, feel free to email us at info@yorkhospital.com. So now that our housekeeping duties are complete, we'll move on to the reason that you're all here today. Why would you want to access a York Hospital patient portal? Well, quite simply because that's where you'll find your York Hospital healthcare information in a secure online location. And you can access it on your own timetable, regardless of where you are, anytime, anywhere. Additionally, portal access makes it easy to share information with anyone that you might need to share with, your families, your friends, perhaps even sharing with a provider that may be located in another state if you're not living in Maine year-round. And this, of course, brings us to everyone's next question. Why are there two portals, and how do I know which one I need? We absolutely understand. We get this. It's confusing and it can be very frustrating. And now is the time to demystify York Hospital's tale of two portals. We certainly want to acknowledge that ideally, there would be only one integrated electronic medical record system, one portal, where our patients could go to find all of their healthcare records and information online. And we absolutely want to assure you that we've heard you and we still hear you. Working toward one portal for all patient records is a major priority for all of us here at York Hospital. And it is a major component of the hospital's multi-year investment and strategic plan. However, until we get there, we are here to help you and all of our patients navigate the current portal landscape as smoothly as possible. So now back to our question. Why are there two portals and how do I know which one I need? Well, the Cliff Notes version is this. The hospital patient portal allows you to access lab and imaging results from the services that you receive at York Hospital, while the provider practice patient portal allows you to access those results as well, among many other things that I'm not going to get into because it would keep me talking far too long, and Fia and Kami will go over those in much greater detail. So there's lots more to know about both portals. And with that in mind, I'm going to pass the PowerPoint presentation over to Maria Evangelou, our resident expert on York Hospital's hospital patient portal.
Good afternoon, everyone. Thank you for joining us today. My name is Maria Evangelou, and I am the administrator of the Hospital Patient Portal, which is also referred to as Centellus. As Jean mentioned, I've worked here in the hospital and medical records for over 20 years, so I've acquired a lot of knowledge, and I urge you to feel free to pick my brain, metaphorically speaking, of course. Next slide, please. So the question, why would I want to access the hospital patient portal? So if you have an inpatient stay at our hospital, you will be able to see your discharge diagnoses, your medication list from your stay, your allergies, and your lab and radiology test results. Also, for patients, you don't have to be just an inpatient to use this portal. This portal can be used by anyone who has lab or radiology testing done at a York Hospital site. So it can be inpatient if you come in through the ER, or if you just have outpatient lab or radiology testing, you can access these results when they are finalized. And now I believe we are going to our video.
York Hospital's Hospital Portal is a secure online website that gives you 24-hour access to your lab work and imaging results. The Hospital Portal, which is named Centellus, is a self-managed service, allowing you, the user, to create your own account if you have not yet established one. The account is free to create and requires only a few steps to generate portal access. Visit the yorkhospital.com website on your device and navigate to the Patient Portal and Telemedicine link at the top of the navigation menu. On the Patient Portal page, navigate to the link labeled Hospital Portal. This will open a new browser window on your device. As a first-time user of the Centellus Healthcare Portal webpage, you'll need to register for a portal account. The registration link can be found below the Sign In button. Click Register here to continue. Select Patient as the registrant type. Complete the patient information form seen here. All form items are required. Read the terms of use and the privacy policy by clicking the referring links. When ready, check the box to acknowledge having read the documents and to give consent to York Hospital and the portal software system as an authorized user of the portal. Click Next to continue. The portal requires a valid email address and your date of birth. It is recommended that you also provide your primary contact phone number to ensure accurate account details. Click Next to continue. By default, the system will use your email address as the username for the portal account. This is recommended to ensure a unique username has been selected. However, you may enter another unique username for your portal account login. If your username has already been taken, a pop-up will alert you that your username is already in use and requires a different username to be created. A password is required to access your portal account. You will create this unique password here. Best practice for secure passwords is shown on screen. Re-enter your chosen password to confirm you have typed the password correctly. If at any time you have forgotten the password you chose for the portal account, you'll be able to reset the password by requesting a password reset at the login page. Click the Next button to save your password and continue. If you receive an error, please verify that your password meets the password requirements and that the passwords match. York Hospital takes security of your account information seriously. To aid in the verification of your account information, should you forget your login or username, the following security questions will be used to verify you. Please provide an answer to the 3 questions. Each question can be changed using the drop-down selector and choosing one of the available questions. Click Login to complete your portal account setup. The hospital portal dashboard is the first screen displayed. It provides a quick glance at commonly accessed information you may need to find within your portal account. If you are new to York Hospital or have not yet established care, the dashboard may be empty. As your medical history with York Hospital grows, more content will be available to you through this portal. To complete your profile setup, you'll need to add York Hospital as your healthcare provider. This is a mandatory step to ensure that your account has been associated with York Hospital. Click the green Add button at the top of the dashboard. This will take you to the Providers page of the portal. In the upper right corner, select the Add Provider or Facility button. A search form will open requesting a facility name. Enter York Hospital in the Search for Provider or Facility field, or the York, Maine zip code 03909 in the zip code field. Click Search and one result will appear as York Hospital. Click the Select button to continue. York Hospital has now been added as a facility to your hospital portal. The status is set to pending as hospital staff will now perform the necessary administrative operations to connect you with your internal hospital records. You'll notice a request to verify your email account is present at the top of the dashboard. This verification ensures you are the owner and have access to the email account provided. Click the Verify button to initiate the verification email process. A pop-up window will appear asking for a verification code. Proceed to your email account to retrieve the Centellus email with the subject line, Verify your email address with Centellus. In this email is a 6-digit code. Copy the code to the pop-up window and click Verify. If you did not receive an email with a code, you may initiate another email be sent by clicking the Send Another Code link on the pop-up screen. Visit the yorkhospital.com website on your device and navigate to the Patient Portal and Telemedicine link at the top of the navigation menu. On the Patient Portal page, navigate to the link labeled Hospital Portal. This will open a new browser window on your device. Enter your username and password to access your Hospital Portal account. If you forgot your account password or username, click the Forgot Password or Forgot Username links and follow the on-screen prompt to initiate the recovery process. For more information about the hospital portal or for answers to commonly asked questions, use the Contact Us form on the website and select Patient Portal. You may also send an email to info@yorkhospital.com. To speak with a member of our Hospital Patient Portal support team, call 207-351-2184.
Okay, so we are now back to patient portal tips for the hospital patient portal. Tip number 1, which you saw in the previous video, is you must, in the provider field, put in York Hospital. If you either leave this field blank or attempt to put in your own PCP, you will not be connected to the hospital database. So you may look, it looks like you have a portal account. You can log in and put your password in and open up the screen, but you will not see information. So this is vitally important. Next screen, please. Tip number 2, there's an area where you can add a dependent. This is only for minors under 18 years of age. If you do have the legal right to view the records of a spouse or an adult relative, you will need to get that legal paperwork to the medical records department so we can have that on file. And you can either email that paperwork to the the email site on your screen, or you can call the medical records department if you need to discuss or have any questions. Next screen. Our third tip, which is, so when you have the portal and you get lab or radiology results, you will get an email notification with a link in it. So it's really easy to access the portal that way. However, say you had some testing done maybe a month ago, you had a chest x-ray and you either want to print it out or download it, or you just want to look at it. So you need to find the website. This is the best way to find the link to the hospital portal, is to go to the yorkhospital.com website and click. There's, as you can see on the 2 red arrows there, there's 2 areas that say patient portal and telemedicine. So click on either of those areas, and then you will scroll down and see these 4 yellow boxes. You need to click on the far right yellow box that says hospital portal. That will bring you to your login area for the hospital portal, which is called Syntellis. Next screen. Our next tip. We recommend that you do not use Google to try to find the website for the hospital portal. We found that if you just type into Google York Hospital Patient Portal, it often brings you to an incorrect place. So again, the best way is to go to yorkhospital.com and click on the patient portal and telemedicine. That way you will always get to the spot that you really need to be at. Next screen, please. Tip number 5. If you are savvy on your computer and know how to place bookmarks, this is a good thing to do. So then you won't have to keep typing in the website address every time. Next screen. Oh, red arrow, sorry. Common questions. So, why am I asked to provide an email address when I am registering for a visit at York Hospital? Well, simply put, if you give us your email address when you register, you will get an automatic invitation to the York Hospital portal. The whole video you just watched about the hospital portal was predicated on not getting an invitation and someone attempting to go in and log themselves in. It's a process which is fairly simple to do. However, if you give us your email address and you get a link, about 90% of the information that you have to type in will already be auto-filled. It is a much, much simpler process. And just to note, you will only get 1 invitation. So don't worry if you feel like you're going to get inundated every time you come to the hospital. If you give your email once, you'll only get 1 invite. Next screen, please. The big elephant in the room. Why are there 2 patient portals? So I am discussing, and I'm the administrator of the hospital patient portal, but we also have a practice patient portal. The practice patient portal is actually very robust and has a lot of information. However, that practice portal can only accommodate patients who belong to those practices. It cannot accommodate patients who don't belong to the practices. That is why we have this second portal, which we refer to as the hospital portal or Syntellis. In this hospital portal, it doesn't matter who your provider is, who orders your test. All it matters is that you get your testing done at York Hospital, a site. So any of our walk-ins, the main hospital, that's what you can see in the hospital portal. So, and you really don't need, if you belong to the practice portal, people ask, should I belong to both? Generally speaking, you really only need to belong to the practice portal if you are a practice patient. That's the recommendation. Next screen. Oh, and now I am going to hand it off to Kami and Fia to discuss the practice portal.
Thank you, Maria. My name is Fia. I'm going to begin to talk about the Practice Patient Portal. The Practice Patient Portal contains the medical records from any of these York Hospital practices. So as Maria indicated, our practice portal is robust, but it depends upon your being a patient of one of these practices. We're now going to turn to a short video on how to sign up for this portal.
The York Hospital Practice Patient Portal is a secure online website that gives you 24-hour access to your health information, scheduled appointments, lab results, and more. With your Practice Patient Portal, you can be in control of your health and care. The Practice Patient Portal can also save you time, help you communicate with your provider, and support care between visits. Your provider's practice will create a portal account using the email address you provided them. If you are not yet signed up for the Practice Patient Portal but would like to be, please contact your provider's office to get started. Once you've been signed up for the Practice Patient Portal, you will receive an email similar to the one shown here. This email will contain your unique username. You will use this username to log into the Practice Patient Portal. Click the button in the email labeled Set Up Portal Account. This will open an internet browser on your device that brings you to the Account Setup web page. To ensure that you are the authorized user who is accessing your portal account for setup, a one-step verification is required. The verification process is simple. You may choose to receive a verification code by voice or by text message to the phone number on file at your provider's office. You may have more than one phone number associated with your account, such as your home phone and cell phone. Keep in mind that your landline phone does not have the ability to accept text messages. Only select text for your phone number that is associated with your cell phone. Make your selection and click the Send Code button to initiate the verification process. If you selected voice, you will receive a phone call immediately on the phone number you chose. This automated phone call will speak the 4-digit verification code to you.
Hello, this is a call from Helo.com. Your 4-digit verification code is 79777. Once again, 79777.
If you selected text, your cell phone will receive a text message containing the verification code, which will consist of 2 lowercase letters followed by 4 numbers. Once you have received the verification code either by voice or by text message, enter that verification code in the box as seen here. If you were unable to understand the voice code or did not receive a text message, use the Resend Code button to reinitialize the process. With the verification code entered into the text box, click Verify to continue. A password is required to access your portal account. You will create this unique password here. Best practice for secure password is shown on screen. As a reminder, do not start your password with a special character. Re-enter your chosen password to confirm you have typed the password correctly. If at any time you have forgotten the password you chose for the portal account, you'll be able to reset the password using the same verification code method in the previous step or by calling your provider's office. Click the Next button to save your password and continue. If you receive an error, please verify that your password meets the password requirements and that the passwords match. Passwords are case-sensitive. The consent form explains the guidelines for using online communications through the Practice Patient Portal and are a required step in setting up your portal account. To continue, please review the eClinicalWorks consent form and select the checkbox next to I have read the consent form and the above information. Then click Agree and Next. After acknowledging the consent forms, your patient portal dashboard will appear. The Practice Patient Portal dashboard is the first screen displayed. It provides a quick glance at commonly accessed information you may need to find in the portal. If you are new to your provider's practice, the dashboard may be empty. As your medical history with the practice grows, more content will be available to you through this portal. The email used to set up your portal account has a link to the portal login page. For easier access to the portal's login page, simply visit yorkhospital.com and click on the Patient Portal and Telemedicine link at the top of the website's menu and scroll down to view the 4 options on this page. The hospital utilizes multiple portals for various patient use. To access the Practice Patient Portal, navigate to the Practice Portal button in the middle of the page. This brings you to the same login page as the link in your email. Use your username and the password set in the previous steps to access your Practice Patient Portal account. For more information about the Practice Patient Portal or for answers to commonly asked questions, use the Contact Us form on the website and select Patient Portal. You may also send an email to info@yorkhospital.com. To speak with a member of our Practice Patient Portal support team, call 207-361-6902.
Thank you. We hope you found that video useful. What I'd like to do, similar to what Maria reviewed, is just to review a couple items that we found helpful to patients as we help them, assist them in signing up for the Practice Portal. Just as a reminder, unlike the hospital portal, the Practice Patient Portal is one that you need to receive an email invitation in order to sign up. If you don't receive that email, please check your spam folder. This email invitation comes from a no reply email address, and sometimes it automatically goes into that folder. If you're unable to locate that email, please call your provider practice so that we may verify your email address that we have on file, and they can then also resend the invitation to you. You and family members can use the same email address, but when the practice enables your account, you will each receive a unique username. That unique username will be reflected in the emailed invitation. Next slide, please. In that authentication step, we recommend that you review the last 4 digits of the phone numbers displayed. If you could just check to make sure that these phone numbers are current so that you will receive that voice message or the text. If it doesn't reflect your current number, please call the provider practice to update that information. You can see that keeping your email and your phone numbers up to date at your practices is important to continue to receive this patient portal communication. Next slide, please. Again, that if you choose to receive the code by text, remember that the verification code is received in the body of the text, and it contains the 2 letters and 4 numbers, as we see here. Next slide. Once you've logged into the portal, here is a picture of the dashboard. As we indicated in the video, the information that is displayed on the dashboard does get more robust as additional things are recorded in your medical record. You can see at the top of the dashboard is a box that contains some notifications. These are things that we update periodically. They have to do with practice news, your hospital news, or even things about the practice portal itself. By clicking on the box at the top right, that expands this box so that it's easier to read all the information there. Then you don't need to scroll up and down to see all the notifications that are included in that box. Underneath there, we see many tiles. The tiles themselves show the most current information, but each tile does have a link for View All. So say, for example, the appointment tile, it's going to show my most current appointment that's coming up. But if I click the View All button, it's going to show all the future appointments that I have scheduled for any of the York Hospital provider practices. The other nice feature of the practice portal is the things that you can do to message the offices. One of those is on the current medication tile. You can see the button for request refill. I don't know about you, but I always remember that I need a refill either first thing in the morning or last thing at night when the practice isn't open. You can use the request refill button in order to request that refill at any time of day. The other nice thing that you can use the practice portal for is messaging. Now, sometimes we, a week after our appointments, think, oh, my provider told me that I should do XYZ, but that really isn't working for me. I have a question that I would like to ask my provider that's not urgent. It's not something that I need immediate assistance for, but that I'd like to correspond with my provider on. I can choose the View All option on the message tile and compose a message to my provider office. Next screen, please. The other nice option here on the patient portal is the medical records section. So this you can see on the left-hand side here, and it offers a couple different options in here. So we can see the first option there is a personal health record. Here is where I can do a from and a to date and view in a list format all my records during that particular time frame. So it would include things such as my diagnoses, my medication list, allergies, maybe any referrals that have been requested and authorized during that time, any lab and radiology results that have been added to my medical record during that period of time. The next option that you see there on the screen is the visit summary option. This provides a view of each appointment separately. So as I'm seeing at a particular practice, if I click on visit summary, I'll see the appointment date listed there and a visit summary box. As my provider documents more information, that visit summary will refresh. So I can view that visit summary as soon as I'm seen at the practice. So as soon as I get home, that will be available to me. Once your provider finishes that progress note, that once he's documented all the information in regards to your visit with the provider, you will see that a visit note box will appear next to that appointment date. That provides you a view of all the information that that provider has documented at that appointment. So it gives you exactly the view that the provider would see if they're looking at that documentation. Both the personal health record and the visit summary sections are able to be downloaded to a PDF or printed for your information. I'm now going to pass on the presentation to Kami.
Thank you, Fia. So we're going to look now at the ways that we can get to the login page you will receive an email notification, just like for the hospital portal, anytime that you have a publication available. So if your provider has reviewed a lab result or a radiology result, or if someone at the practice or your provider has sent you a message, you'll get an email notification with a link that will take you directly to the login page. If it's just some day that you'd like to log in and you haven't received that notification, or like Maria had shown us, if you haven't bookmarked this page, the best way to get to the hospital website is by typing it directly into the address bar. So you'll type www.yorkhospital.com. And then from there, you'll click on the patient portal and telemedicine button. It's important, again, not to Google. There is also a York, Pennsylvania that has a hospital, so sometimes you might get taken there. We just want to make sure that your result is accurate. So again, the best way is really just typing it into the address bar. So we'll go to the next slide, please. Once you've clicked on patient portal and telemedicine, we'll see these 4 orangish, yellowish boxes. Similar, Maria talked about clicking on the hospital portal button. Now we're focused on clicking on the practice portal button. That'll take us to the login page. We'll go to the next slide. So on the login page, you're going to click View Your Health Record. That'll open up the window where you can enter your username and your password. You'll click on the User Credentials radio button. Now, if you're like me and you have a lot of different usernames and passwords for things and they're hard to keep track of, and you're just having difficulty, one option that you have is clicking Trouble Logging In. We'll go to the next slide, please. We'll go through the next series of steps. Once you've clicked on trouble logging in, this screen talks about if you've forgotten your username. So there's a couple of quick steps. If you enter your first name, your last name, and your date of birth on this screen, and then hit submit, that will prompt the system to send you an email that'll include your username in the body of the email. And next slide. The next option is forgot password. So we have the forgot password radio button selected. On this screen, you'll enter the username that you've already either retrieved through email or you have written down. You'll enter that here and then you'll click submit. And next slide. So the resetting your password email will arrive, and that will have a link directly, you can see in blue where it says reset my password. That'll be a link that takes you directly to the password recovery. So the next screen that we see here, there's a screenshot of, it's the password recovery section. So you'll enter your username again once you've received this email and hit submit. Next slide, please. The next step is, it's the 3-step process. It's the user validation. So similar to what we saw in the video, we're going to verify that our phone numbers look correct. If they're not, please reach out to the practice so they can correct those. You're going to choose the option to receive your unique code based on the phone number that you've selected. So in this example, we have selected the phone number that ends in 5409, which is a cell phone. So we're going to choose the text option to receive our code. And we're going to hit send code, and we'll go to the next slide, please. And so in step 2, it's the verification code entry point. So depending on how we received our code, we either received a 4-digit spoken code, or we received this 6-digit, which is 2 letters and 4 numbers via a text message. Either way, we're going to enter that code here to continue resetting our password. So once we've entered the code, we'll hit verify. And that's going to take us to step 3, which you can see in the screenshot here. That's where you'll create your new password. And again, the password guidelines are available by clicking on the password guidelines. That'll just expand to let you know the requirements of creating a strong password. So you'll enter your new password and then you'll confirm your password at this screen. And then you'd hit the next button. That'll take you directly to the patient portal dashboard, which Fia went over in detail about everything that's included in your patient portal. So we hope you find the Practice Patient Portal to be a convenient and easy way to access your health information and a really helpful tool to communicate with your provider's practice. At this point, we're going to turn it back over to Jean in case there are any questions that have come in.
Sorry about that. I am looking at the Q&A icon at the bottom of my screen, and I don't see any questions, that can't possibly be true. There must be some. We certainly have time to type it in. We did receive a few questions from folks who responded to the RSVP for the seminar, and we have those in a slide, and we can certainly go to those in the interim if we like. We just wanted to make sure that we had the opportunity to cover anything that our guests today felt wasn't covered enough in the presentation itself. Oh, yay, we have one. Are you still associated with Change Healthcare Portal?
So I will take that one. The hospital portal has had 2 name changes over the years. So Change Healthcare is now Syntellis. So it is the one and the same. They have just changed their name. It used to also be called Relay Health if you've had the portal a long time. So.
Okay. Any more? Well, let's go to some that were provided to, oh, nope, before we do that. How can you see the actual provider note for your visit without a specific request to medical records, not just the assessment or the plan?
I think I can take that one. Kimmy and I are going to both jump in here at the same time. So if you're a patient of one of our York Hospital practices, you can view your actual provider note by going to the medical records option that we showed on the left-hand side and choosing the visit summary option. Once your provider completes the note, the whole note will appear. So initially it will just be the visit summary, and the visit summary will change over time as your provider is finishing their note, the date of the appointment. But once they finish the note, you'll see the visit note box appear, and you'll click on there to view the whole record.
Okay. Now, next question. Do you recommend using the Hilo app?
This is great. So I'll answer this one. Lots of questions. We love these. So that's a great question. The Hilo app is definitely a helpful tool if you're a user that prefers to use your smartphone or a tablet. That's a great app to download from the App Store. It's available on both Apple devices and Samsung devices in the App Store under Hilo. The important thing to know is that you do need to create your portal account on the web, so in a browser, whether that be on your computer or in the Safari browser on your device, to create your portal account first. So you will need to log in initially to the patient portal through the browser mode before you can log into the app. But the app is a great on-the-go way to access the same information, just in a little bit more concise screen size on your mobile device. The app is really user-friendly. Everything displays a little bit differently, but it is a really helpful tool. And certainly if you have questions, Jean will go over that at the end. We can help you walk through that. It was just a lot of information to cover both of those things, but that's a great question, and we definitely encourage folks to download the app.
Okay, next question. Do I call the office to ask them to initiate the text to get set up?
I guess I'm trying to make sure I'm interpreting that question correctly. Do you mean the email to? I apologize. If it refers to the email that you receive with the invitation, that would come from the provider practice. There is also, we do also have the ability to text patients if they prefer. What we ask all of our offices to do is to speak with you when you're checking in for your appointment to review your communication preferences. So do you prefer to use the patient portal? Would you prefer that the office, text you appointment reminders, prescription, refill messages, that type of thing? So I apologize, I'm not sure which text you're referring to, but please, yeah, let us know in the Q&A box if I haven't answered that question fully.
I was just going to say too, just in case it's referring to the text message verification code, that will just be part of, like Fia's talking about, once the office initiates that request for you to get a portal account set up, that'll be a step in that series of sign up parts once you've clicked on the email link. So maybe just in case that's the question.
Yeah, thank you.
Okay. Next one. So the very first step in accessing the patient portal is to call your provider for a code?
So this is a great question. The very first step is providing your email address, whether it's to the hospital registrar or the provider practice support staff at the front desk. They can enter your email address, and at the practices, they'll enable you for the practice portal, and that will initiate the email link to be sent to your email address. That'll have a URL in the body of the email and a series of steps that you'll follow to create your portal account. If you're being asked for a code, we want to make sure sometimes if folks are Googling York Hospital patient portal, you do get taken to a site that is really specifically for our physical therapy patients to access their exercises. Sometimes that does ask for an access code. So you want to make sure, again, that we're following those steps and kind of accessing the patient portal from either the email link, which will take you directly to the correct spot, or going right to yorkhospital.com. You shouldn't really be asked for another code. Just as like we talked about as part of verifying your account from the first step, but you'll get to that from an email link. Does that help answer, I hope? Okay.
Okay, the next person asked about Helo, so I think we pretty much covered that in the previous answer. So next, what happens if the provider doesn't include one of the issues discussed at the visit on the information portion?
I will take this one. So I would encourage you to wait for the visit note to be published to the portal, because once you see that link to your visit note, then you know that the provider has indicated in our electronic medical record program that he or she has completed your progress note and completed the documentation of your appointment. Certainly, if at that point you're reviewing your visit note and you're not seeing the information that you discussed with your provider, something that you would expect to be there, we would certainly encourage you to call that provider practice and ask about that information. Or your other option would be to use the message functionality within the patient portal to send the practice a message to ask, I didn't see this particular information. Can you include that as part of my medical record?
Okay. Thank you, Fia. If I am using the same username for both the hospital patient portal and the practice patient portal, can I use the same password for both as well? I know you don't want me to do that, but I need to keep it simple.
That's good. I think passwords hit all of us, right? They're difficult to keep track of, and we have so many of them. But yes, if that's something you feel comfortable doing, we certainly they're separate portals right now. Like Jean mentioned, the goal ultimately is to have one portal in the future, so this makes it much easier for you. But at this time, yes, if you're able to use both, the same password for both, that's fine.
Okay, and next, would it be possible to get a printout of the steps necessary to access the patient portal? I think I can answer that one, which is an absolute yes. Not quite yet, but by the end of this week, when we send out the email to you folks with the link in it, it will also include links to 4 separate flyers that will give you a step-by-step 1 through 8, 1 through 7, all the details you need to access or even register for the all of the patient portals, both of the patient portals rather. So an absolute yes to that. Okay, so back to the Helo app. Are we supposed to have the username and password via yorkhospital.com process first, and then we could download the Helo to our mobile device to access the info?
So I believe it's my turn. Kami and I said we would alternate here. So yes, you would need to set up your portal account on a web browser first. And then that's the information that you would use the first time that you log into the Helo app. Once you log in one time, you are given the option of setting up a code to kind of simplify your signing into the patient portal on your cell phone. So it does get simpler, the next time that you log in, but you will need that username and password first in order to access the Helo app on your cell phone.
Okay. And the last one so far is okay. So I call the office and I tell them I want to set up a patient portal, and they will email me, and then I will be given a unique code and then go through the verification. Is that correct?
Yeah, so I hope that we're doing explaining this correctly. It does get really challenging. The first step, you're right, is to give your email address to the provider's office. They'll send you an email invitation. As part of that process, once you click on the link in the email, it'll take you directly to that login page that was shown. From there, in order to create your username and password, that's when you have to choose how to receive a code just to authenticate yourself. The portal is making sure that you are who you actually are supposed to be in accessing your record. So it's to keep it secure and safe for you. So you will get an option to get either the code via voice or text. But that does get kind of it's initiated from the email invitation. So I hope that's clear, but please reach out when we give you the contact information. We can kind of walk you through it step by step as you're doing it live. I don't want you to feel like we're sending you off on your own. We're always available for questions at our helpline, and Jean will share that information after for you.
Okay, another question appeared on screen, so let's go right to that. Do PT and OT patients, physical therapy and occupational therapy patients, have any access to notes?
So
Oh no, I say we all look not through the hospital portal.
And not on the practice portal either. Unfortunately, the first slide that we presented when we started talking about the practice portal, PT and OT are not part of our electronic medical record program, at the practices. So unfortunately, those don't all appear on that practice portal. As Kami said, there is a PT OT portal that you can request access for at your PT OT office that will give you some information in regards to exercises and things that they may have recommended for you. But unfortunately, it's not available on our York Hospital portal or our practice patient portal.
I was just going to say, if there's something that's not available on its own in the practice portal, you can always give the office a call and they can push a document to you. So we do have the ability to publish specific documents if it's something your provider has already seen. So certainly reach out to your practice, because we can make things available to you electronically if you put in that request.
Well, it seems that the questions from our guests today are all, oh, nope, 1 sec. Okay. Do you need to utilize that invitation link within so many days, i.e. 48 hours, just in case requested today, but not able to set up until, let's say, the weekend, which at that point I would have to request it again?
So I'm going to speak to the hospital portal. So if you come in and I'm not sure which portal you're referring to. I'll let Kami and Fia speak to the other. But for the hospital portal, you come in and you give your email address at registration and you get a link. That link does not expire. If you called and asked for a second link, then that first link would expire. But for at least the hospital portion, that initial link lasts a very long time.
I believe, I don't want to misspeak, Via, so correct me if I'm wrong, but I think we have a pretty long length of time for the practice portal as well. Similar to what Maria is saying, if you request a new link, then the old link, when you go back to that, may give you the error that it's expired. But you do have time, certainly over the weekend. That's a good length of time. The things that really expire a lot more quickly are the password reset emails. Those are designed to have you kind of actively resetting your password once you get the email, but the initial setup is good for a while. And certainly if you lose that invitation, that's another reason to give the office a call. They can always resend you. So don't feel like you have to hold on to that indefinitely. We can also have the system send you an email with that link again.
Okay. And this is a good follow-up to that. What if you signed up for the patient portal but never used it and 2 years have gone by? Do I need to re-sign up?
So I'll answer for the hospital portal. You will be able to sign back in as long as you remember your username and password.
And for the practice patient portal side, you don't need to re-sign up, but we did have all our users reset their password back in October of last year. So if you have not signed in 2 years, then you could use the same username, but you would need to use the forgot password option to reset your password.
Okay. Are there any more? We still have a minute or so. And we also have other questions that have been submitted previously. If we want to do those, or we can certainly simply include the answers to them in an email when we send you the reminder on Friday. I don't see any more questions. Let's see. Okay, gang, do you think that these are easy answers or should they be written out? So you tell me.
I think they're questions that we get a lot, it looks
Okay.
like, just reading through these quickly. So people might want answers, and then we can
Okay.
certainly send. Yeah. I'll
Then
take
let's do it.
the first one. Can I message my provider's office through both portals? So currently messages are done through the provider practice portal. Those are what the provider receives directly into the EMR and then allows them to message you back through that same form of communication. And then you'll get the notification that you have a new message. So currently just through the provider practice portal.
So you cannot message a provider through the hospital portal, to be clear.
The next question, can I download or print my medical record from both portals? And the answer to that is yes, you can.
Are my lab and radiology results available on each portal at the same time? We get this question a lot. And the answer is yes, although it'll look a little bit different. So I can speak to the fact that for the provider practice portal, once a result is resulted over at the hospital lab, that result comes electronically to your provider. It also goes immediately to the practice patient portal. It will, however, be under the personal health record, which Fia mentioned in her slides. was a date range search that you can pull. And so you would just search for the day that you had your labs drawn or your radiology testing performed. And then you'll kind of scroll down the page through the summaries and your result will be there. We like to remind folks, though, that at this point, your provider has not reviewed those results. That is available to you immediately without their review. Once the provider has reviewed those results, you will get an email notification that your results have been reviewed. That will publish to the latest results section of the dashboard that Fia showed you. And that may also include a comment from your provider. If that's how your provider and you communicate, that comment would also be available on the test at that time. So yes, they just go to different spots at different times.
Great.
And the last question, why am I getting an email from Allscripts asking me to join Allscripts Health Connect? Should I join this? Where is my access code? I'm going to keep this short and sweet. If you get an email from Allscripts, please ignore it.
Well, that was easy.
Yes. I could speak much longer, but just ignore it.
Okay, great. And I'm keeping an eye on the Q&A still, and doesn't seem to be anything else coming in. So we'll move on to just a reminder. I mentioned earlier in the program that today's webinar is being recorded, be available on our website and the YouTube channel by probably this Friday, I would imagine. And we have also created a number of the flyers that somebody asked for earlier in anticipation of people that like to have a piece of paper right next to them as they're going through the step-by-step process. And they will look similar to what is on your screen right now. So you'll see what should be up on your screen as you click on or fill in the various fields that are showing up when you're either trying to navigate or register for either of the portals. So keep an eye there, and we also post that on our social media channels as well. And next, okay, additional questions. There are so many ways to get to the answers that you need. Please don't hesitate to try any of these because we'll all be happy to help. The first one is simply using the contact form. That's the contact us form, on our website. That will go to community relations, and it often goes to the practice portal support team. And if it doesn't, then we get it to the right folks so that you can get an answer to your question. The same way is info@yorkhospital.com. Again, it comes to the community relations team, and we'll make sure we get it to the folks that can give you the right answer to your question. The next one was the practice patient support team, and that's for the provider practices. So that's Fia and Kami's folks. So that's the 361-6902 number. It'll get you right to them. And if you need help with the hospital patient portal, Maria and the folks in medical records are also able to help. That is the 351-2184 number. And indeed, thanks for joining us today. We were thrilled to be able to share the information with you, and we hope it's helped to clarify some of the questions and take away some of the hesitation or the angst that you might have had about either of the portals. So that's it for today. We hope you can join us for future community webinars, maybe not portal related, but we have a lot of other interesting and expert information to share with the community, and we hope you can join us. Keep an eye out for us on Facebook, and also anytime you visit the homepage, there'll be a slider right there that tells you what's coming up next. So again, thank you so much and enjoy the rest of your afternoon.